This week's Ask Dr. Durie is a very important question coming from a patient who wants to know, how can one establish a strong communicative relationship with one's doctor to achieve the best results? And so obviously this is the central aspect to achieving care with your doctor, to have communication, to be able to discuss what's going on and the options for testing and for treatment. And the simple answer for this questioner is that it can be very difficult to achieve this kind of a relationship. And so you need to start in a simple way. At the time of initial diagnosis, there is certainly a key and a very important need to have a planning meeting. And so this can be set aside as a 1-hour meeting and should be requested by all patients early in the disease course to request that treatment planning meeting. And if available, family members should come in for this meeting to have an explanation from the doctor about the disease, what are the prognostic factors, what are the expectations in this case, and to lay out the treatment for the coming months. And so this really has to be requested as a special meeting, which is different than the routine and often much, much faster follow-up meetings. So moving forward, one has to have a plan. So in this meeting, one should set the stage and say that there is a need to have copies of the lab testing results and any results from scans and the like to be provided at the time of each visit so that the patient can follow along and keep track of this information. The other aspect is for the patient to become knowledgeable about the disease. As Susie Nova says all the time, knowledge is power, and this is certainly true. And so one directly or through a support group or through a direct patient contact, one needs to gather up as much information as you can about the disease so that you can be informed to talk with your doctor. And this is important because for the follow-up, as this questioner was well aware, the time is frequently short in follow-up visits. And so you need to gather up your information, and it's helpful for the patient to summarize the results on a flowchart to help the doctor. And then be prepared to have your questions, but keep it brief so that the key elements can be discussed and decisions can be made. And so one needs to be proactive in this regard, to have the results, to be planning ahead, and be ready to get input from the doctor. And so what is the bottom line? Well, these are some good tips that I'm giving to you, and it may be possible. It may be that you need to have a follow-up phone conversation if there's not time at the visit. But if this is really just not working out, the bottom line is that you may indeed need to search to find another doctor who can follow along in the way that you need to be able to communicate, to get the answers that you need, and to move forward so that you are having the best possible care.